So, lymphoma is a neoplasia arising from the lymphoreticulae system, normally lymph nodes, spleen, bone marrow, but there's lymphoreticulae material throughout the body, and so therefore we can have lymphoma arising anywhere, the CNS, testicle, skin, you name it, ocular. There is lymphoid tissue anywhere in the body, and therefore it is possible for lymphoma to affect any area of the body. But lymphoma, we must remember, is a diverse group of diseases. We're using this bucket term of lymphoma, but we can't imagine that that means all lymphomas are identical, are going to present in exactly the same way, are going to have the same prognosis and progression, or finally the same treatment options. It's a little bit like saying a dog has a fracture. Well, there's a whole world away from having a fracture of P3, which is of no relevance to the dog and it's not even lame, all the way through to a fracture of its skull, which might be life-threatening. So we use the term lymphoma, but actually what we need to do is remember that that term encompasses a whole range of separate entities. The incidence in lymphoma is high both in dogs and cats, and it's the commonest cancer in both of those two species, and the incidence appears to be increasing, as it is in the homolog disease, non-Hodgkin's lymphoma, in people. A variety of different ideas and theories as to why this might be. There is an association between herbicides in people and the development of B-cell non-Hodgkin's lymphoma, and also evidence both in people and in dogs, although the evidence is very weak, for a particular herbicide who I can never pronounce, so I call it 2,4-DPG. There's certainly some studies that have shown dogs who have access to lawns that are regularly treated with professional pesticides, whatever that may mean, because it was a whole group of different compounds, and of course the owners didn't necessarily know what they contained, but certainly there's an increased risk in dogs whose play areas have been professionally treated compared to those of us who just let our gardens overgrow and don't do anything specifically. And there may also be a risk correlated to the local presence of electromagnetic fields, i.e. power lines and so on and so forth. Conspiracy theorists unite.
Electromagnetic as in mobile phone signals, Wi-Fi signals?
That has not been correlated in dogs.
So
it's only power lines and so on. Or in the case of one of my clients, a putative alien landing. Right, so I suspect you've seen cases of canine multicentric lymphoma before, and we have lymphadenopathy or lymphadomegaly. That lymphadenopathy is normally rubbery and mobile, rather than the firm, fixed, hard, gritty feeling lymph nodes that we tend to encounter when they have metastatic disease within them from a carcinoma, sarcoma, melanoma. And often there are other signs that have initially brought the dog to see you: anorexia, lethargy, weight loss, PUPD, a whole gamut of different signs. And I'm sure you've experienced the dog who bounds in is absolutely fine and the owner has noticed large lymph nodes, through to the dog who is very, very unwell indeed, and you detect a subtle lymphadenopathy and go down that route and diagnose lymphoma. So in our presentation, we also have this huge spectrum. But that, what we think of as the common presentation, whilst it accounts for 8 out of 10 dogs, don't forget, as I said at the start, that we have lymphoma can arise in any other site in the body. And those areas that we see more commonly than others are in dogs: craniomediastinal, alimentary disease, cutaneous disease, or then all of the others as we've just mentioned.